Turn it a little bit so I can see it just in case. Is that okay? Great. That's really helpful. Oh, thank you. Thank you. Good afternoon. As you know, we've made the first steps in reopening our economy. We've lifted some restrictions on low-risk construction and outdoor recreation like fishing and hunting, and we've done this in a responsible way at the right time, I believe. Today, we are also pleased to be able to issue additional guidance to our hospitals on what procedures qualify as non-urgent surgeries. Some surgeries at doctors and hospitals were uncertain about how to go forward on our Stay Home, Stay Healthy initiative. And this will allow additional patients to have non-urgent surgery. It's going to obviously help people get access to new joints and the like, and it will help with revenue picture of hospitals as well. And I'm pleased that we have been able to do this in a way that will make sure that our nurses, our respiratory therapists, our physicians have access to personal protective equipment. And that's an important part of this because we want our heroes working in our hospitals to be adequately protected. I think we found a way to have both more non-urgent surgery and protection for our medical staff. We know that in every instance of reopening our economy, our guidance for lifting these restrictions are based on data and science. They're based on our ability to appropriately guard our health. Over a week ago, I said that I did not expect that the entirety of our Stay Home, Stay Healthy measure could be lifted on May 4th. And today I'm confirming that based on the data and science, that is the case. So based on the data at our disposal, the current order of Stay Home, Stay Healthy will remain in effect. And we will have more details Friday on the phased-in approach about how we will open our economy in a safe way. And we want to be comprehensive and transparent about that decision-making. That's one of the reasons we're here today. So today we are going to go through the metrics, the numbers that we will be looking at to determine when we are able to start the next stage of that reopening process. You might think of it that we have started down that process by reopening construction. We have started down that process by opening outdoor recreation businesses. And for the next steps, what we're going to talk about today is the metrics that will inform us about when we start the next step of the next phase. Friday, we will talk about what those phases will be. So you might want to think about it that today we're talking about when we will be making those decisions and how we will make those decisions. And Friday, we will talk about the what of how those phases will actually work. So this is a two-part discussion starting today. In general, I know this recovery has seemed long, but if we can avoid having to reinstate these restrictions, we know this very simply. The quickest way to reopen our economy is make sure that we get this job done. We do not want to go through this pain again. We want to make this a one and possibly done situation that we then can restrain this virus through testing and contact tracing and isolation of the relatively few people who become infected. So the fundamental principle we're following is let's just do this once and get it over with. And I think it is much better to be disciplined now with this approach rather than have erratic steps at a later date. I think one way to look at it is it's much better to do something 100% one time than have the sacrifice of 90% twice. And that guides our decision making in this very difficult challenge that we have today. I'm joined today by retired Navy Vice Admiral Raquel Bono, State Health Officer Kathy Lofi, and Catherine Guest, who is the Deputy Intelligence Section Chief of the State Emergency Operations Center. And they'll be available to answer questions after I talk a bit. Today marks 100 days since our first case of COVID-19 was identified in our state. And we know our statewide community has changed greatly in ways large and small. And I think this may be one of our most difficult times that we've had in the state of Washington, but it is also the perhaps best time to demonstrate our community commitment to laying a sustainable foundation for the health of our state. It was FDR's prolific first 100 days where the concept of 100 days of action, I think, was started. We will see how history treats us about our leadership during these first 100 days and the days to come. And I hope that we will see great success. And we have seen considerable success already. We know those first 100 days have been extremely challenging and life-changing for all of us. And thankfully, the vast majority of Washingtonians have really responded admirably. That's why we've been successful. And we recognize that people want to go back to work. We want to open our businesses. We still can't do that for many of our folks safely. But we can give a picture of what the spread of the virus looks like and what we can do to mitigate it. So every day we review the data, in fact hourly sometimes, and the public can view almost all of the data we have at the Department of Health website. That's at coronavirus.wa.gov, coronavirus.wa.gov. So we have sort of 5 buckets of metrics that we look at in this process. And I just want to show you what they are in general. All of them need to have reduced risk. All of them are in a position today that we have to improve our current situation if we're really going to take the next step of reopening. And as this chart indicates, these are first, disease activity, second, testing, third, contact tracing, fourth, risk to vulnerable populations, and fifth, the status of our healthcare system and its ability to respond to the pandemic and its readiness. And I'd like to talk about them with you today so we can be completely transparent with Washingtonians about how we're making these decisions. One thing to note, under each of these kind of buckets of metrics, there are multiple metrics, and I'm sharing just a few of them, the highlights, today. You'll notice that there is no one factor in our discussion today that is completely dispositive, and that's by necessity. There is no one number that is a magic number that can guide our actions. We have to use our judgment, which means we look at all of the numbers that go into the central question of when we can reopen our business in a way that doesn't dramatically increase fatalities in our state. So the first metric is our disease activity graphics. And this is a place we should start, obviously, because it's the status of the virus in our state. And I want to show you some of the metrics that we look at. They are not all, there are other things we do look at, but these are some of the highlights. First, we look at the cases per day judged by the date of the illness onset. This is a bar graph, obviously starts in February at a very low level. It rises through March, begins to go down in April, and you'll see we have case counts right now in the 100 to 150 range. And by the way, the last bars are somewhat incomplete, by the way, because we accumulate numbers late in the day sometimes. So what we've seen is on the cases we're having by day. Now, these are cases where we have confirmed a person that has COVID-19 by a test. They've gone up and they have gone down to some degree, but they are still significant. We still are seeing on a daily basis as to the diagnosis of the disease in the range of 200 Washingtonians a day. That's too high. And we have to get these numbers down to a level where we have wrestled them down to the ground so we can move to the next phase of our recovery, the next phase of opening our business, and the next phase of how we really insulate and isolate people who are infected so they don't infect other people in the community. Nonetheless, this is showing some progress, but we are not out of the woods yet. The next metric we look at are deaths per day by the date of the illness onset. So what this graph shows is it shows the deaths that happen judged by the date that a person's illness started. And that's important because obviously people are in the hospital for some period of time between the time they get ill and between the time of their demise. So we backdate these to look at the date that people actually got sick. And you'll see that this has gone up significantly during early March, reached a generalized peak, and has come down during the April period. But we are still not at the level where we can be confident that if we release our social distancing, these numbers will not begin to go up as well. Our next metric that we look at our cases of COVID-19 hospitalization by the date of first admission. So we compile the hospitalization of people as they come into the hospital, and this chart shows that number by the date of the first admission. Again, goes up through March, reaches a peak, and has come down. And this is a good sign because it gives you some sort of hopeful projection of the upcoming weeks of people's course while they're in the hospital. But again, the numbers are too large, and we have to get these numbers down to a position where we can be confident that the numbers will not spring back up again, according to the epidemiologists. And by the way, I'm very appreciative of our expertise, some of which is on the phone today. It's very, frankly, makes me proud when I talk to Dr. Fauci and Dr. Burtz and Dr. Redfield, who are in the administration, who run the CDC, and they tell me repeatedly that they believe our public health agency here is one of the best in the nation, and they certainly have been doing great work in the last 100 days. So we've seen some progress, but we're not down where we need to be. The next chart is the cases of COVID-19 hospitalization by illness onset, and that is a little different because it looks from the date the illness started rather than the date that people actually came into the hospital. But fairly similar curve in that regard, coming down far enough. The next slide, and if you'll bear with me, this is a bit complex, but it's very, very important into our calculations. This shows the effective reproductive rate as best judged for the illness in King County. This is for data in King County. We really don't have data to allow this evaluation statewide yet, but King County is instructive. This is called the R0 number. That means letter R, number 0. And basically what it tells you is how many people become infected for each person that is infected. And you'll see that that number was over 3. It was approaching 4 in February of this, or excuse me, in March, early March of this year. And that meant that for every person who became infected, almost 4 other people became infected. So in order to stop the spread of this disease, obviously you have to get that number down dramatically. Now in King County, it looks like we have accomplished that. The R0 number is down by this dashed line, which represents 1. And as you'll see on the sort of beige to the right of the screen, it shows the spectrum of the most recent evaluations. Again, this was a few weeks ago, down around the level of 1. And what that means is for every person who's infected, they would infect 1 other person. Now, that's good in the sense that the numbers would not grow over time, but neither would they shrink. And the problem is that we have only achieved this level by very vigorous social distancing. The allied effort of millions of Washingtonians, particularly in King County here, have joined together to get a social distance that has made sure that we limit that to a 1-to-1 infection rate. But if we remove the social distancing, that number is just going to go back up again, according to the epidemiologists, and we'll continue to see a growth of the disease. So the fact is we have to get this number down to be in a position to assure ourselves that this virus isn't just going to come roaring back. And we need to see continued improvement on this R0 number if we're going to have confidence that we will be able to restrain the progress of this virus. The next 3 slides are important because they show projections of the future according to our modelers. So we have access to some of the best modelers into the world. These are folks who look at the daily data and plug it into their algorithms. They make certain assumptions about the course of the disease, and they provide a projection into the future. Each model is based on somewhat different assumptions and data sets, and we look at all of them. The first one is with the Institute of Disease Modeling here in Washington State, a well-respected group. And I'm going to take just a moment to go through this slide with you because it's a very important metric in our thinking. Basically, the dots you see are data points, and the model then reaches, in a sense, averages of these data points. And what the line shows in the middle of this sort of beige area, you'll see that the line went up in March, in a sense peaked or plateaued in late March, and is projected to continue to go in somewhat flat and just maybe a little bit decline if, this is a big if, we continue our social distancing, if we continue our efforts. But the model also projects a gray line on the right side of your screen. You'll see a gray line that starts to ascend again. That is the line that depicts what will happen to the number of people getting sick if we abandon our social distancing at this time or shortly after this time. It goes up dramatically. And when I say dramatically, I mean that. It means hundreds of people will die. And I have to tell you, I just don't think we can become inured to death. We see numbers, but each one of these numbers is a person. It's a son lost their mother or brother lost their sister. And this is a serious slide to look at because it means if we stop our efforts today, we're going to see a lot more people die in the state of Washington in not too distant future. So this is the Institute for Disease Modeling. A second model is by the Institute for Health Metrics in Seattle. This shows a similar depiction of some of the historical events and then predicts some things happening in the future. The red line, the solid red line, shows the historical numbers of the deaths per day, and then makes some projection in the red dotted line moving forward. The little vertical dash line is where we are today in today's date, or close to it. Now, unfortunately, I have a different slide that I meant to put in here, but the IHME modeling essentially depicts the same thing that the previous model depicted if we abandon our social distancing. And their projection would then show that dotted red line, which today is going down. Their projection is it will continue to go down, but only because we're doing our social modeling, our social distancing. It would start to go up again fairly dramatically if we were to abandon our social distancing. I'll show you a third line. Youyang Gu, he's with MIT, again has some projections going forward. If you look at the projections of their modeling, not quite as optimistic given the rate of the curve is not as steeply down. But again, this is only if we continue our social distancing. So the summary, if I can, of this first bucket of metrics is that we have made progress. Washingtonians can be proud of the progress we have made, but we know that this disease will come roaring back if we abandon our current operations. So we have to go further to get these numbers down so we then can go to the next stage of reopening our economy and moving to our next stage of containing this virus, which I'll get to in just a moment. So our next bucket, if you will, is testing capacity and availability. Now, this is very important because obviously if you're fighting a war, you need to know where the enemy is. And our ability to know the status of the disease in general amongst the population is very important on what strategic decisions we make and when we make them. When can we open up some of these businesses? We need testing to be able to have an assessment of the status of the pandemic in this regard. We also need testing to be able to identify the people, obviously, who have the virus so that they can be isolated to prevent the spread of the disease. And I have to tell you that our testing capacity has been sorely taxed. If we could look at the slide, this is a slide, if you look at the bar graph in the lower left-hand corner, the beige and kind of tan graphs, there's some good news in our testing capacity. If you look at the tan-colored bar, it shows that we could do ideally 22,233 tests a day. That's the possible maximum of the capacity to analyze tests. That means when you take the sample, you run it through a machine, and they give you a result. So the machine part of this, we have over about 22,000 we could run a day. That's a fairly good number. We would like it to grow over time, but it would be a good start. Unfortunately, because we don't have additional swabs and the viral transfer media, that's how they transfer the sample to the lab, we only can do about 4,650, which is the darker tan bar. So what you see is we have to have increased testing material if we're ever going to get to what should be the capacity for tests today, so that when someone calls up and said, I've got a fever and I've got a cough, boom, we can get you tested right away within 24 hours, and we can take the next measure. Now, our success in this is dependent on our ability to get test swabs and to get a viral transport medium. And as you know, if you've been listening to some of our discussion, we have been urging the President and the federal government to give us greater assistance. We have scoured the globe for this material on a daily basis. I talk to CEOs of companies around the world about the ability to get access to this material from Switzerland on east. But we simply have to manufacture more of these products. And so we have been urging the President for some time to use the Defense Production Act to essentially order companies to make these products. We are desperately in need of this so we can get people tested in our long-term care facilities, in our meat packing plants, and everybody on the street who has symptoms can be promptly tested. There's been resistance to that proposal, but now we're seeing some glimmer of hope. I was told by the admiral in charge of this 2 days ago that more swabs would be sent to us from the federal government in the next week or two. We are very hopeful that that promise is met because it is necessary if we're going to achieve our goal of getting this testing capability that is very necessary. We've been appreciative of people around the state helping us in this regard. We've got some help from some local business people that have helped us find some access. But we need a guaranteed long-term stable supply in the millions of these test supplies to be able to help Washingtonians get tested in an appropriate fashion. Our next bucket of information is the necessity to have a very vigorous effort to, once we have people who are positive, to make sure that we investigate all the people they have come in contact with so that we can contact those people and get those people isolated so that they can protect their health and so that they don't continue to spread the pandemic. This is a very labor-intensive process. It involves armies of people being on the phone and email and text messages, first interviewing the person who has a positive test and then going out to everyone around them and finding out who could potentially be being affected, getting those people tested and isolated if in fact they need isolation. So if we can look at what we have now about the potential of people working on this subject, if you look at this bar graph, it shows the number of case investigators that we now have and will have working on this. Today we have about 565 people statewide who are working on this issue. We hope by May 4th it'll be 1,378, and by May 11th we're shooting for 1,500 people. We're standing these people up. We are training them. We are training them in the privacy measures that we have to take care of. and using the technology to use whatever appropriate technology we have to communicate. So that is going on. We're very appreciative of the Washington National Guard. They're contributing about 700 members of the Guard that are helping build this capacity. And this is one of the highest priorities from the state of Washington right now. We have to treat this like a fire department. When you call for a fire, the fire department comes. And when you call with the COVID symptoms, we want you to get the same kind of response so that we can get on these diseases right away. So we're working on that, making good progress. The next slide shows some of our places where we have isolation and quarantine capacity in the state of Washington. It shows where where we're in excess of our 50% goals in that regard is in the green. And so we have facilities in most of our locations, but we have more to provide, and we're looking for additional isolation capacity. Now, I'd like to talk with you for a moment about a very challenging issue that we're going to be faced. And that is that as we find more people who are positive for this disease, and we will, because we will be doing more testing, most of those people, first off, all of those people will have to isolate for all of our benefit. And most of those people will obviously want to do that in their homes. That's going to be very challenging because when people isolate in their homes, it's not just them who have to isolate. Their whole household has to isolate. That means they can't be going outside of the house, except maybe for a moment's walk around the house. So that's going to be very challenging for our families, but it is one place where we can all be supportive of one another. Those folks are going to need people to do grocery shopping for them. And, friends can do that. We are going to have some capacity to do that as well. But that isolation is absolutely critical if we're not going to go back to a reemergence of this virus. And I appreciate everybody's work to help on that isolation capacity that we will be building to succeed on this. The next bucket of information we're looking at is risk to vulnerable populations. We know that we differ in our ability to sustain ourselves economically and otherwise, and so we evaluate what kind of risks there are to the most vulnerable amongst us. So if we can look at the next slide. Some of our most vulnerable clearly are people in long-term care facilities. And this slide shows the number per day of additional long-term care facilities that are reporting COVID-19 infections in their facility on a daily basis. The blue line that's climbing up there is the cumulative total of long-term care facilities that have COVID-19 in their facilities. This is an extremely important metric for us because these are the most vulnerable citizens in Washington state. And our ability to restrain fatalities is significantly dependent on our ability to make sure these people get the closest infection control humanly possible. I'm pleased that we now have strike teams that are out into many of these facilities to make sure they use the best protocols to reduce infection in the facilities. And I'm glad that we acted early to try to restrain visiting of people coming into these facilities. Very difficult for us not to be able to visit our loved ones, but critical for their survival not to interfere and inject these viruses into these facilities. You'll see that this is a significant number. Today, it's about 225 of our facilities have confirmed COVID-19, and that's why we were particularly vectoring in to make sure we do everything humanly possible for these folks in these facilities. The next slide that we are looking at is the divergent suffering dependent on vulnerable communities and a lack of equity. This virus is not totally equitable, and we're concerned about that. If you look at the demographics of the Washingtonians who are suffering from this disease, you see differences. This might be difficult for you to read. I'll just read a couple of our numbers. For our Hispanic members of our community, Hispanic folks represent 13% of our community, but they represent fully 30% of our cases. So the Hispanic folks in our community are having a disproportionate impact on them because of this disease for a variety of reasons. And we want to see every way we can to reduce that disproportionality that exists for. I'll just leave it on that right now rather than leave the entire graph. It shows an interesting disparity, however. The fatalities are different. Hispanic folks represent 13% of the total population, but 8% of the fatalities. So this is a non-equitable virus, and we are dedicated to finding all we can to try to reduce the inequities associated with this, in part by doing things like having standards for workers in the agricultural community. One of the things we're working on right now to provide standards of hygiene so that folks to reduce the risk. And testing is obviously very important as well, so that when we have folks that might be working in the ag community who are in difficult situations, we can increase the testing capability. This goes back to this testing capability that we talked about. The last bucket is our healthcare system readiness. We've been focused to make sure that our health system can take care of any surge of the pandemic, and so we evaluate that on a daily basis. The slide I'll put up now basically shows the available beds that are available in the state of Washington to care. These are additional beds that are available in our system, but currently are not used by a patient. And you'll see that we have maintained a relatively healthy number of just under 1,000 additional beds that could be available if the pandemic springs back upon us. This is important because this virus has been shown to frankly explode. That has happened in New York, it's happened in Louisiana, and we have to make sure that we have that maintenance. We also see a number of ventilators that are available. On April 28th, it was 848. As you know, because we've been successful, we've been able to send back ventilators to the federal government, and that's a good thing. And this is frankly a testimony, this graph, to the diligence of Washingtonians who have really abided by the social distancing strategy, and Washingtonians ought to be proud that we have kept people out of the hospital because we've made decisions about not exposing ourselves to this virus. And I want to thank everybody in that regard. And if you'll forgive me for a moment, I'm going to note a couple notes. The last slide I will show you is the status of our state personal protective equipment procurement. We have been intensely focused on improving our PPE access to people. We've been so frustrated. Many nurses have not been able to have the masks they needed. Emergency personnel have had to reuse masks. We need additional masks for our industrial components as we bring companies back online. They're going to need additional masks as well. So we have been searching the globe for this material since day one. I'll just give you some sense of where we're getting our PPE from. There's a pie chart you see. We've got about 13 million pieces of PPE through our state procurement system. We've received just under 3 million from the federal government, which we appreciate, and we've got about 2 million in donations, which we appreciate. Many businesses have been very appreciative. They've found stockpiles of this and they've donated it to the healthcare system. We appreciate that. But this is well short of what we need. And if I can, the right-hand bottom chart shows what we've ordered in the top orange line, shows what the dates we wanted to receive in the sort of broken stair-step line, and the little blue at the bottom is what we've actually received. So what you can see is we have been both dedicated to obtaining this material and have not been able to get material as we need from any source. This is again something we've urged the President to use the Defense Production Act to order companies to make this material. That is starting to happen, and we'll hope that that will accelerate. I want to thank the business people that have been pitching in. Today I had a visor that was manufactured by a company in Tacoma, Outdoor Research. Dan Nordstrom is now making masks for us. Many small companies are making all types of equipment. I want to thank the business community for helping on this critical shortage. So that is a rundown of our metrics. I'll just close before I stand for questions of a comment about these metrics. And that is, I think what we saw is there is no one number that any of us can hang our hat on to make an independent decision based on one number. We have to look at all of these in compilation, and we have to make sure that they all are significantly improved so that we can move to the next phase of reopening our economy that we will talk about Friday. But we've got the information that we need to make that decision. We just need increased and continued discipline and determination and resilience and compassion that Washingtonians are showing big time across the state of Washington. So for that, I'll yield for questions.
First question comes from Rachel. You mentioned the current tests that could be done, but is there a number between the 4,600 that are currently being done daily and the 22,000 that's a goal that you're looking for as you continue to turn the dial on opening up the economy? And then also, is there a plan to do random statewide testing of asymptomatic people to get a better handle on how many people are out there who may be contagious but don't have symptoms and would need to be isolated as businesses start reopening and people start going back to work?
Yes, your first question is, we think a realistic goal during the next month or so is in that 20,000 range capability. And the reason we think that's a reasonable goal is, A, it's really what we need to be able to have that very rapid testing of everyone with symptoms so we can get them isolated. And this is critical because, you know, we've been dedicated and we have been effective in the blunt instrument of social distancing. But this is a surgical approach. This is like a smart weapon against this virus, which is testing, contact tracing, and isolation. But that starts with testing. And we think that range of 20,000 is really necessary to give us high confidence we're going to be able to do that on a very rapid basis. So we need to have that tool ready to go as we go to the next phase. The reason we think it's reasonable is that if the federal government's statement that they gave me 2 days ago, I was on a call with the president and the vice president, and Admiral Guar, who's in charge of this process, and he told me flat that we would have enough of our swabs to quadruple our current testing in the next week or two. So we are basing this projection on that, and I'm very hopeful that that comes through. And I know the Admiral is sincere in his commitment to us, but I also know that we've run into glitches in the past. So that's a realistic goal, and we have it. Your second question about broad-scale testing of non-symptomatic people. To be able to do that, to have some better surveillance about the spread of the disease. There is the start of a process to be able to do that by doing antibody testing, using serology testing, and that's going on now in Seattle, where we are looking at, when I say we, I mean the research labs, are looking at used blood that is left over from the blood bank and looking to see what percentage of those have antibodies for the virus. That means people with antibodies have been exposed to the virus. Doesn't mean they have that. So that is the start of validating that process to be able to move forward. There are also some other companies that are coming up on antibody tests that might be able to do these antibody tests in mass. I talked to Siemens company yesterday about that. They think they have a technology that might come in several weeks that could do mass testing for antibody testing. And that will be useful for surveillance purposes, so we can get a handle of what the percentage of people is that actually had the disease that may have been asymptomatic and they didn't even know it. But I want to offer a huge caution about this, because there's some folks that have argued that this is a get out of jail free card, that once we can do that broad scale antibody testing, we can all go back to work under the very mistaken assumption that because you might have a positive antibody test, you were therefore immune from the disease and immune from transmitting the disease to other people. There is simply not medical research to really show that that's the case yet. In fact, the World Health Organization said that that's just not an assumption that any of us can make at this time. So further research might show that, plus or minus, but at the moment, we cannot cannot depend on antibody testing to set us free. We cannot depend on getting an antibody test, showing that we have the antibody, and then feel free to go back to work and ignore social distancing. That would be a potentially fatal mistake. Now, there are some that are trying to trumpet that and suggest that's why we should just abandon our current efforts. But that is a very dangerous bet, and we cannot gamble on this.
Next question comes from Joe with the Seattle Times.
You have given some specific metrics on things like the number of testing you want to see for things to open back up. But what are some specific metrics for the information you just shared, some of the charts that you want to see before the state can reopen? For example, what number of cases per day would you like to see? Where would you like to see the reproductive number at? And what percent or number of ICU beds available would you like to see?
Yeah, I'm sorry, Terry? Yes, thank you. Well, I'll take a crack at it, and then I'll have Kathy respond to this as well. Look, we want to see zero, obviously. It might be able to have some confidence with a compilation of numbers in the single digits, perhaps. If you have the number of admissions in the single digits of those with COVID positive, and that's combined with very, very low numbers of fatalities, and that's combined with a trend of a continued reduction of the percentage of people in hospitals that have COVID-like systems, and that's combined with a decreased percentage of the people tested who have that disease. If you combine all of those, and those are all very low numbers, all in essentially single digits, you might be able in a position to make a judgment. But they all have to act in concert. We can't make any decision on one of those, or we could make a disastrous misjudgment. Kathy, do you want to just talk about that?
No, I thought you answered that well. And I mean, for example, in terms of these dials working together, like, for example, if we had 4 times as much testing now and we had, the same number of cases as we have now, that's a very different situation than if you're, testing 4,000 people a day and, having 200 cases a day. So you really do have to sort of look at all these different pieces together. And I know this is frustrating for people. People want, an exact number, and they want to know what we need to get to. And I think that the answer, it's just not as easy as that. We need to look at multiple things together.
The way I liken it is, when you go to the doctor, it'd be comforting if you can say, just doctor, give me the number to tell whether I got a problem or not. But that just doesn't work in our human health. We got to know blood pressure, lipids, weight, age, whether you're diabetic. There's just a host of these things. And if we're going to make a smart decision, it's going to be based on the whole compilation of these multiple metrics. But I am confident that we have had really good epidemiologists working on this. We have some of the best in the world that are in Washington State, and they have allowed us to make decisions so far that have really borne out well. That's why we've been able to lower the curve. That's why Washingtonians have shown such huge confidence in what they're doing. There is enormous consistency of people who are abiding by this effort. So I think we ought to be confident in our judgment going forward. And I want to thank everybody really thinking about this deeply.
Governor, you can't give specific numbers. Is it possible we may never be able to reach the level that you really desire, and you're going to lose support of people around the state who are looking now county by county and region by region opening?
No, we're going to stick together, and we're going to make the good decisions. We're a resilient state, and we've demonstrated that already. People across the country are looking at our successes and are proud of what Washingtonians are doing. I think you mentioned something about a regional approach. There is consideration being given to having somewhat earlier dates to start some of these next steps. We have not made a final decision on that, but it's something we're continuing to look at the data about. But no, I just feel extremely gratified that Washingtonians are recognizing, A, we can be successful because we have been successful, and B, we're not going to make giant mistakes of waking up and thinking the sun's shining so we can, forget about this deadly virus. Look, we've lost over 700 people already because of this virus. And we're going to lose that again in the next several months if we do not stick with this. And I'm convinced that Washingtonians both understand that and love their community and their families enough not to expose them to that. And I think we've demonstrated that. So I feel good where we are, except it's a big challenge.
Comes from Jim with the Spokesman Review.
Governor, regarding the president's executive order to keep meat processing facilities open under the Defense Production Act, will Washington take steps to keep places like the Tyson plant in Wallula closed, where there are so many workers that have tested positive? It's closed right now, but if they decide to open up under Defense Protection Act, and then on a similar vein, the president asked governors to consider reopening schools for a few weeks at the end of the school year, and some officials in Spokane say they're hopeful that could happen. I'm wondering what you would tell them.
Well, first off, I appreciate them thinking about the education of our youth. As you know, we made a decision to act as a state on this to allow the perfection of our remote learning techniques. So for the information we have today, we don't see that as an option, and that we are appreciative of our educators who are being so creative, maximizing our remote efforts. But right now, look, we don't have the testing capability to run that risk right now. If we went back to school tomorrow and little Johnny had a fever and a cough, that school would probably have to shut down because of the demands of parents. And if he was tested, then you'd just be right down in a shutdown mode. And we can't test them rapidly because we have to prioritize those tests for the people who are in hospitals. This is why I've been so diligent trying to urge the president to be more productive in getting these testing materials supplied. So in the absence of that, I don't think it probably is in the cards to open up schools right now. Your other question about the meat packing plants, I believe that the state could take steps under our own jurisdiction regarding these plants, but it hasn't something that I've been briefed on, and we have not assessed that question. So I can't give you a direct answer to that question right now. What I can tell you is that we need more testing capability, and we need additional PPE for these hard-working workers that are working in very, very tight quarters, frankly, and very difficult work to begin with, and we have to increase our support for these working people. They feed us, and they're in very close quarters frequently. And we ought to be dedicated to their health. It's important to their health. It's important to our food supply. And that's why we're dedicated to improving these metrics that we need to see improve.
Next question comes from Drew with King 5.
Good afternoon, Governor. Two questions. One, Costco is implementing a mask-only policy for customers. Do you think the state's recommendation needs to be more of a requirement, especially if we are talking about dialing down some of the restrictions eventually? And then on the Western States Pact, can you explain to folks who are frustrated because they see beaches in California open and they see talk of perhaps loosening restrictions in Oregon and Colorado, of course, what is this pact if everyone is doing their own thing?
Well, it's more of an agreement to communicate than a pact for some common decision-making, because we recognize our states are different. We're at different places on the curve. We were hit first and hardest. It's one of the reasons we took an appropriately aggressive position. And because we did that, we've had some considerable success, probably as much or more than any of the other states. So it's more of a communication agreement to share ideas than some agreement to do things at the same time. That's just not practical because each state is significantly different. Colorado has a more optimistic view coming down than we do in the modeling, for instance. So we're making good decisions based on Washington data and Washington science and Washington's health. As far as the California beaches, I know that's frustrating to Governor Newsom as well. And it's one of the reasons that we have to continue to ask people to be observant and use leadership themselves. Look, we all have to be leaders here. And if you're sitting on a blanket with 10 other people and 9 of them are in a different household, you're just creating a risk for other people that are beloved by you. And I know that's hard to figure out sometimes, but when you do that, that means somebody's grandparent may die in the next several weeks. And so we hope people will continue to observe good decision making. We opened up our outdoor recreation under the belief that Washingtonians are going to be responsible, and we need to be, because we don't want to have to shut down outdoor recreation again. We don't want to have to do this again. So we need people to step off the trail when people are coming. We need not to sit down on a blanket in a state park with people who are not in your household. You really ought to keep moving when we're recreating right now. It means only being in people in your household when you're in a boat fishing, or in a car, by the way. If you're driving someplace with people who are not in your household, it's just not necessary or a good idea right now. So what I'm saying is we need people to be leaders, and we hope that they will be. They need a few more leaders in California. We'll see what Governor Newsom does about his beaches. We have closed many of our beaches in part because they are such a draw that they have overrun some of these local communities. They've stressed them for their food supplies and their hospital capability and their safety. So places like the Ocean Shores and other places have simply asked us to be under the beautiful blue Washington sky at home, not driving 150 miles. By the way, it's still nice where we live. I mean, it really is. The sky is kind of above us everywhere. Within a few blocks of your home, you'll probably be able to find a bird or two in a blue sky. And that's going to have to do right now.
Next question comes from Jerry with the Everett Herald.
Governor, today, Snohomish County Health District rolled out for the first time its use of the rapid testing machines from Abbott. I wonder if you could tell us how many of those machines are in use now in Washington, how many more are coming to the state, and are those machines that provide results in like 15 minutes? Is that the vehicle to achieve the widespread testing, the 20 to 30,000 you hope? Is that the vehicle?
No. Kathy, Rocky, you want to talk about that?
This is Kathy Loki. I can start, and then Rocky, you can add anything you want. I don't have the number in front of me right now as to the number of machines that are in the state. I know that the federal government initially gave us around 15 machines that we distributed kind of geographically throughout the state. I believe Snohomish did receive one of those machines and is using that rapid test machine. One limitation to the Abbott test machine is that we have seen some results that its sensitivity might be low, and the sensitivity is of all the people who have the disease, how many people will test positive using that test. And so another way to say that is that there can be falsely negative results. And these tests are not, do not appear to be as sensitive as the PCR test that you send to an actual laboratory. So there are benefits of the test because it's very fast, and you will have, an answer right there for you in a matter of 15 minutes. But, the drawback is that you may be missing some cases because some cases may be falsely testing negative. So there are some advantages and disadvantages.
And the only thing that I would add to that is that while these were only, I think it was what Kathy said, there was only 20 machines total that came to the state. But the limitation are actually in the testing pods themselves. There was not a lot that we received, and so we're waiting for the resupply of those pods to run the tests. And so that's the other limiting factor.
The other thing we've been told is that the time period to run a test is much longer. So the ones you can do with a machine is in the dozens per day, if I'm right, whereas the larger analytical machines do tens of thousands, or thousands anyway. So for the mass numbers we need the different types of mass analytical machines. That's not to diminish what Abbott does. They do some other products that have the mass testing that we would love to use. By the way, there was a question about masks I forgot to answer. We are still evaluating the benefits of masks, and so we haven't made any really dispositive decisions on that. We're still looking at that to look at the scientific benefit of masks. So we hope to have more to say about that.
Q13.
Hi, Governor. You said just a couple minutes ago that you made the decision to reopen outdoor recreation out of your belief in the ability of people to go out and to do the right thing. But these are areas where we saw, even when the risk was known, we saw hundreds of people up at Rattlesnake. We saw hundreds of people over on Elkai Beach. So why do you have faith in the ability of people to abide by the rules when it comes to outdoor recreation, but you don't have faith in the ability of small businesses right now to be able to operate in a safe way?
Well, to start with, if we find out that people are not showing decency, we'll have to shut those beaches and Rattlesnake Ridge down, and that'll happen. We just have to be aware of that if we do show common sense, we're going to continue to have good outdoor recreation, and if we don't, we'll just have to close those facilities. That's number one. Number two, when you talk to people and you want to encourage them to positive behavior, I found it's much more to honor the expectation that they will do really good positive things rather than to shake your finger at them about doing negative things. So I'm trying to encourage Washingtonians to that really positive behavior. That's why I talk about it in this sense. The other thing is the issue about this whole issue of reducing our physical interactions. What we have found is that even if you have perfect social distancing at a particular event or site or business, that the mere fact that you're traveling around inspires or enables you to have more physical interactions. When you drive somewhere, you stop at the gas station, you talk to people, you go to your sister's house and talk to people, you stop at a different place. The mere fact of being out and having activities increases physical interaction. We think some estimate of the reduction of physical interactions we've caused because of this might be around 50%. And it might be a lot higher and it might be a lot lower. But you have to reduce those physical interactions in every instance to some degree to actually slow down this pandemic. So that's our thinking on this.
Next question comes from Ashley with the Chinook Observer.
Hi, Governor. I wanted to ask something about, you mentioned that the beaches are shut down. My understanding is that, at least in our county and Pacific County, that the beach approaches are shut down, but people are allowed to walk on the beach. And the reason that distinction is important is that today our Board of Commissioners was discussing whether or not it's right to reopen those beach approaches and whether that would cause an influx of travelers. And do you think that that they consider that decision, that the stay-home and non-essential travel ban is enough to prevent a second wave of people heading to the coast and trying to get out here during this time while so many people are out of work and trying to find activities to do with their families? And the second question I had for you was you mentioned that the administration is tracking the deaths that are from identified COVID cases. Are you guys also tracking overall deaths in the state to see if there's any difference from previous years, if there's been an overall spike in people dying that might have been not caught as a COVID-19 case?
Kathy, I don't know the answer to that question.
Yes, we have discussed that, and that analysis is underway. I don't have those results for you.
We are in the process of signing a data sharing use agreement with the University of Washington School of Public Health so they can help us with some more analyses, but that one's definitely on the list in terms of looking at overall mortality.
Question about beaches, I think, is largely a matter of the local community making that decision, so I don't have any particular guidance. It sounds like the commissioners are going to make a decision based on local conditions.
Hannah with Cairo Radio.
Hi, Governor. Questions. One, we continue to get calls and emails from people who are struggling with their car tab payments. And a couple of weeks ago, you had said you might consider a grace period for people, perhaps who are unemployed or are struggling. And we were just wondering if you had an update on that. Had you thought about that? And if so, what's the outcome? Also wondering if you can define social distancing moving forward, if you know what that might look like as we move ahead. Is it still, masks, crowd limits on gatherings, or more safety guidelines like we see with grocery stores and construction?
Well, there are a number of actually orders regarding social distancing that the state has issued that are the law of the state of Washington. For instance, in construction work, when we opened up construction, it was with an order that people would maintain social distancing, and that generally means 6 feet. And so those are in our orders today, sprinkled throughout the system, and in all situations, we should maintain that. And it probably doesn't vary very much, so that is in our orders and our guidelines as well. And I don't anticipate the science is going to change on that. With this exception, I will say that I've long believed, and I think there's increasing evidence that this is a very transmittable virus. For whatever fatality rate it has, it seems to be very transmittable. You look at the choir in Skagit County that, my numbers may not be right, it was like they had like 60 members and 45 people were got the virus from just one choir practice. We see that in whole families becoming infected from like one dinner. So my suggestion to people is we just have to be very cautious about maintaining that distance. We don't have any news on car tabs. Somebody, just as I was walking in, I was told the Supreme Court made a decision that had the injunction that would remain in effect, and that's all I know about it is what I've just been told.
Last question.
Final question goes to Jim Drew with the News Tribune.
Governor, you mentioned the R0 number for King County. Does the state need R0 numbers for other populous counties, and what's the ideal percentage under 1 for that? Also, you mentioned that there are strike teams at long-term care facilities. I was wondering if you have more details on who's staffing that and what they're doing.
Kathy or Rocky, do you want to talk about the strike teams?
Yes, sir. I can start off with that. So we have a couple of strike teams, several strike teams. There are strike teams that come from DSHS as well as DOH. We've augmented those strike teams with some personnel from HHS who have gone in and into the long-term care facilities to assess how they're doing there, to be able to provide some infection control teaching, as well as doing some testing. We've also found that working with the local health jurisdictions and the public health officers, that they've also partnered with UW, Providence, Swedish to also do some of those strike teams. So we have a lot of multi-stakeholders and multiple groups that are working in there to cover most of the long-term care facilities, and they've done a very good job in covering most of them today.
As far as the ideal R0 number, obviously the ideal is 0, but we know we have to significantly reduce it below 1 if we're going to get the infection numbers down. If it remains at 1, we will still have the same number of people infected every day and the same number of people presumably dying every day. So we have to significantly drive that down. Now, we hope to be able to do that, again, through a combination of our current strategies on social distancing and an increased, more intensive effort and capability of testing, contact tracing, and effective isolation. We think that has a reasonable chance of succeeding, but we've got to stand up all of these assets to make that work. Oh, and you asked the question about having a statewide R0 number. Yes, that'd be very useful, but this is one of the reasons, again, we've got to have the testing capability to be able to evaluate that. Yes, a couple things. I appreciate a chance to talk about this. We know people are extremely interested in our decision making. We wanted to share with you virtually everything that we use in making these hard decisions. We've talked today about the things that go into when we make these decisions. Friday, we hope to talk about how those will translate into the next phase of opening in our business life. And I'll look forward to that discussion. Thank you very much. Wash your hands.